Welcome to the regular meeting of the Public Health and Safety Committee for October 23rd, 2024. I am Jason Chavez, and I am the chair of this committee. Before we begin this meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask all speakers to moderate the speed and clarity of their comments. At this time, I'll ask the clerk to call the roll so we can verify the presence of a quorum.
Councilmember Payne.
Present.
Rainville is absent. Ellison.
Here.
Palmisano.
Present.
Vice Chair Wansley is absent. Chair Chavez.
Present.
We have 4 members present.
Let the record reflect that we have a quorum. Councilmember Wansley let us know she won't be here today, and Councilmember Rainville is on his way from City Business of Meet Minneapolis. With that, the agenda for today's meeting is before us. Before we move to our published agenda, we have a proposed addition to our consent agenda to add scheduling a public hearing to amend the Pollution Control Annual Registration Ordinance to include carbon dioxide equivalents. The RCA is before you, and there are additional copies by the door. I will move to amend the agenda to include that item after our consent agenda. May I have a second?
Second.
Thank you. Is there any discussion on the motion to include this in our agenda? All those in favor say aye. Aye. Those opposed say nay. That motion carries and the agenda is amended. There are 4 items on today's consent agenda. Item number 1 is setting a public hearing for November 6th to consider appointments to the Civil Rights Commission. Again, November 6th. Item number 2 is accepting a grant from the U.S. Department of Justice to focus on recruitment and retention of women in law enforcement. Item number 3 is authorizing contracts with a community-based organization to implement the statewide Health Improvements Partnership Grant. And item number 4 is approving a legislative directive requesting an overview of data analysis used to assign violence interrupters across the city. Members, are there any questions on any of these items? I'll move approval of item 1 through 4. All those in favor say aye.
Aye.
Aye. Those opposed say nay. That carries and the agenda is approved. As I previously mentioned, we have added a walk-on item to set a public hearing at our next meeting on November 6th to amend the Pollution Control Annual Registration Ordinance to include carbon dioxide equivalents. The RCA is before you and there are additional copies by the door. Are there any discussions on these items? All right, and if the clerks can please add me as an author on this ordinance, I would appreciate that. And seeing no further questions, I'll move approval of this item. Is there a second?
Second.
All those in favor say aye.
Aye.
Those opposed say nay. That motion carries and the hearing is set for our next PHS meeting on November 6, 2024. All right, y'all, now we can move on to the fun part. We have 2 remaining discussion items. Our first discussion item is receiving and filing a report on the Green Careers Exploration Program. I'll invite Marquita from the Health Department to introduce that item. Or Justo. Welcome up, Justo.
Well, good afternoon, Chair Chavez, honorable member of this fantastic committee. Thank you very much for having us here. My name is Justo Garcia, and I work with the Green Career Exploration Program. This is a program hosted within the Health Department. Let's see if we can get a
Thank you. And as you begin, I just want to make sure the public knows that Councilmember Rainville is with us too.
The whole slide. So, next one. The Green Career Exploration Program was created by the Minneapolis Health Department to meet the needs of emerging green industry while prioritizing access to our historically underserved communities. Our goal is to prepare Black, Latinx, and Indigenous youth and young adults to enter green career pathway. By preparing these communities for green careers pathway, we hope to create community ownership of economy and environmental opportunities that will lead to an equitable climate future for all. Next one, please. Oh, let's see what we got. The question is always what is green career? And to be honest, there is no definition, universal definition. We haven't found one for green careers, but we also look into our partners and we look into the all the activities that are within right now self-identify as a green careers, and we come out basically all of those fall into any of those industries, job and careers that improve, energy use and efficiency, reduce and limit greenhouse emission, minimize waste, pollution, and environmental injustice hazards, protect and restore ecosystems, support environmental communities, and build adaptation measures to our always changing climate. Ideally, and this is important, what should be a green career is the opportunity for a good job that enables wealth creation, improve public health for employees and surrounding communities, are equitable and inclusive, prioritizing opportunities for environmental justice communities. And the most important, too, is to respect the rights and places and practices of our indigenous communities. What is our method? Well, what we apply with the green careers, this is basically the way we look is into a pathway for education and exposure. Within this education and exposure, we partner with the Minneapolis public school systems and community organizations to serve youth, to work with youth. We provide hands-on experience and, including field trip. And we also lead that to credentialing, which is recognized curriculum, industry recognized credentials, and industry partners. Green careers, we look into the green careers, we also want to really look at with the lens of equity. As I said at the beginning, we prioritize Black, Indigenous, Latinx, and communities of color. We primarily target residents of our identified green zones within the city of Minneapolis. We want them to be accessible. So we have two centers, one in South Minneapolis, located at Sabathani Community Center, and the other at the wonderful building, which is the RATC Center. And if you haven't had the opportunity to go there, I strongly encourage you to go. It's a state-of-the-art building. We provide no-cost PACE training. We pay, we understand that some of our trainings actually really can spend a lot of time. And, those individuals who want to change the career changing or improve their employability, they also have expenses. And so the idea is to support as much as we can. We, like I said, have those offices in those training centers. And one of the areas that we really look is into what kind of wraparound services we can provide. We provide for now. We can do transportations and we can do a little other things. This in partnership with the organizations that we work with. However, the idea is to be able to provide more. We know that in some cases, really more intense interaction with individuals, it's what really contributes to success of their participation in those training. We are trauma informed, so we really ask our communities, we work with our communities and let them to lead into what exactly they want to see happening in their communities, and that also include for trainings. We try to reach out to, when we work with our instructors, with our partner organizations, we want them to understand that those instructors have to understand the hardship that our participants, and members of our community have been exposed. This is just to illustrate the timeline of our program. Actually, this started actually with my colleague here next to me, Marquita. We kind of started at the same time, but our health department really didn't have that many individuals that looked like us. But that wasn't not just the city of Minneapolis. I came from Hennepin County, and it was the same thing. And so Marquita was, what is it? Why we don't have this? And I think the direct, I will say, response is, why about just reaching out to our institutions, since a lot of these jobs require extensive training, college, and certifications. And so we want our students to know the pathway for these jobs. And so that's basically how we, Marquita, started this program, and really was able to have a really strong partnership with these educational institutions that we, to this day, we treasure and we are really very proud of. Moving into 2020, what happened is, reality is right now, climate deniers are very few, still, but are very few. And what it is with that is just the realization that, we have to do something. So they look into, number one, limiting greenhouse emissions. And in order to limit greenhouse emissions, we have to really look into those renewable energies. And so we start our first solar training around that time. Moving into 23 and today 24, we actually have growth from that we have right now. Introduction to energy efficiency. We're still doing our solar trainings. We are also doing sustainable land care. We have our youth outdoor and exposure activities. We work with really amazing programs that are able to show our kids or bring them to nature. We understand if you know nature, if you are exposed to nature, number one, you are more likely probably to end it in one career that aims to protect that. And number two, you will be more vocal. And in reality, a lot of our communities have been silent, while many individuals that probably won't be here for too long are the ones that are making decisions on our future and our climate. What is for us into the future? We understand Minneapolis is a very diverse city. We want to provide training in other languages. We have challenges. Some of this training, as I mentioned, they do have certification, and some of the certification have tests, and those are not in English. But we are reaching out to those certifying bodies and institutions, and really looking at ways that we can bring those certifications to members of in our community that can represent what Minneapolis is. We are also, really looking into other areas. Like I said, when we look at all activities that can reduce greenhouse emissions, we see a green career. So in urban agriculture is another of those. If you grow your food, and you same place that you are reside, so that means we are limiting transportation, and you're going to have access to these nutritional products. Our education STEM programs, we work with the Minneapolis School. This is two cool programs, the Gems and Guys in the middle school. And so we work also with grades 5 to 8. We bring our trainers. They do introduction to solar training with them. We actually bring them, and some of you were, thank you, you were We do the environmental justice tour, and we actually visit the council chambers. And we want our kids to learn and where they can come and actually be vocal about those issues that affects their community. We provide field trips. We visit, treatment facilities and areas in the industry, waste and waste recycling facilities, because those also are another areas that provide well-paying jobs. When we look at to youth programming, right now we have also solar. We are entering with CTE, which is the Minneapolis Public School program that basically get those kids that are not ready when they graduate from high school to go to college for Y's next activity, to at least they can have certificates that allow them to enter into a well-paying job. We have Intro to Solar, and we have an ASEP certification for those students. So for those who are 17 and older, because they have up to a year to actually take that certification exam. We have the Sustainable Land Care Program. We are very proud of that program. It's flexible. It provides that hybrid opportunity for our students. They work on the basis of stormwater and best management practices. And really this is motivated by that need of having those best management practice and inspection capacity. Like I said, in our timeline, we are entering into also weatherization. The city of Minneapolis is really, I will say, setting themselves as a model to be followed with the Climate Legacy Initiative. And I think there is an investment that is happening, and we want the residents of the city of Minneapolis to partake in that investment, because the solutions are in their own residence, in their own neighborhood. And so one of those that really it's coming out to them is that part of that energy efficiency. So we are providing those trainings. We are working with organizations that are able to provide those trainings and certification. This is another important training we incorporated also this year, which is the Geographic Information System. We did this with the Smart North this year, and it was an incredible success. But when we look at geographic GSIs, it really present an opportunity for individuals that learn about the system to find solutions within those programs, the problems that are within their area. Additional, we have this year we also have an amazing program with Anthony Taylor. He led the Melanin in Motion. This is an outdoor, again, exposure program with kids. We partner with organization Inspire White. We got kids building aquaponic, doing sustainable land care. We did a really nice program. This was an incredible example of partnership with Hennepin County, the DNR, community organizations such as Emerge, Project Sweetie Pie, and also Tree Trust, and also private organizations such as Birdwoods. They are our tree company. And we were able to provide gardening, urban agriculture, and tree care planting training for our youth. We were able to provide also a stipend for those youth and hire an individual that was able to provide that leadership skill for those youth. We also were very close in home. With our other units, we're very close with our tree programs. We brought some workshops to our communities, and the idea of those workshops was just to teach those residents how to plan, care, and take care of their trees, and recognize when issues were arising with those kids, those trees. Looking into 2016 to present, I mean, we really have, with the Minneapolis Public Schools and Charter School, we have reached out more than 1,100 participants. In our exposure programs, we have more than 117 participants. And in our credential, that include that Soul Earth BBI trainings, so more than 400 participants. And this is a little bit of the demographics. I mean, we really have high representations in one areas. There's still a lot of room for improvement. We want this American Indian and Asian representation to be higher. But like I said, this is, work in progress. And to our exposure programs, we got a little shift here on demographic. We also look into, the ratio male and female, and we also kind of evaluate what are those areas that we have to be more intentional, keeping their being in order to improve that representation. Looking into our credential programs, we have more than 59 NACEP certifications, A+ PPI, and we have this ICP rider is basically a mountain biking or certifications that we got some of our participants this year. This just show, I mean, we used to work in silos, and we are trying to, really move from that. This more just all the partners that we have. I mean, a great representation. We work very close with MCA organizations like Metro Blue, Go Solar, Sparkwike, and I mean, this is all organizations that we really work closely and help us find solutions that we can apply to our programming and to help our youth. And again, we are advancing in that climate equity plan. We work toward the goals that have been set up for us, and of course we for that we do that in partnership with our internal and external partners. We want to increase participation and into this green economy. Wealth is built by and for Black, Indigenous, and communities of color, and community empowerment through educations and resources. This is just information about us, and I just always feel like I have run. I hope, how much time do we have?
You're good. We went through our agenda pretty quick, so you're fine.
Oh.
All right. Thank you. Who still want to hang out for questions? Before we jump to questions, I just wanted to provide some more context and hop back to, I think, the slide. So, good afternoon. My name is Marquita Keys. I am the Director of Public Health Infrastructure and Organizational Development in the Health Department. The Green Career Exploration Program is one of the units of work under my purview. So I wanted to follow up the presentation with some context on our collaboration with the Employment and Training team here at the City of Minneapolis. But before I do that, I do want to reiterate that although we do offer credentials to participants in this program, we're not entirely centered in job training, and so we think that's a really specific point to make, but also to make the point of what we are focusing on is green careers, right? This is a very niche industry, and we want to make sure that our BIPOC communities are prepared for it. So the Green Career Exploration Program, as you heard, ensures early exposure, education, and credentialing toward awareness and preparation for a career in the green sector. We strategize to intentionally engage BIPOC communities into this programming. So you heard about some of the strategies of the program. You heard about our objectives. I just want to provide you some context around, like, softly what we hope for. So through this program, we do hope and expect that the education and exposure opportunities offered to young people in Minneapolis, beginning with elementary and middle school youth, excites them about their future in green careers. We hope that as youth and young adults interface with the Green Career Exploration Program, they find value in the resources offered, and when possible, and as often as possible, they receive an industry-recognized credential. That's really important for the work that we're doing. We hope to design an opportunity that exists on the continuum, that being that youth and young adults that are exposed to green careers through this program will find continuity across their school experience, their summer internship opportunities, and as they complete secondary, post and secondary education, that they become employed in the green sector. That's largely our large goal here. Lastly, we absolutely expect that youth and young adults who participate in this program use their experience and their credential if they obtain one, to be employed, which leads to our partnership with employment and training here at the City of Minneapolis. As mentioned in the presentation Justo gave, we expect this program to be in full integration with the city's workforce development resources, and we expect this to happen in the very near future. We're not there yet. Our goal has always been to develop a formal and collaborative process so that participants of the Green Career Exploration Program who are seeking employment, who are old enough to be employed, are networked with priority to the resources of the Minneapolis workforce team, and that being job preparedness and job placement, and specifically job placement. And so I wanted to provide that context, and we both want to answer any questions, and we have some partners here as well who can also answer questions. Thank you.
Thank you, Justo and Director Keys, for the presentation. We really appreciate it and appreciate the added context towards the end of the presentation too. First, pass it on to Council President Payne.
Thank you, Chair Chavez. Yeah, I was curious how you're approaching our climate equity plan as it relates to the workforce. And I know that we have our climate legacy initiative, and I think there's a lot of figuring out like what the right sequence is to get to that scale up that we need to get to. And I know there's an opportunity to say, take the climate legacy initiative money and insulate as many homes as we possibly can, and that would probably get you a good return on that investment. But from my perspective, one of the things we're trying to do is build up the workforce that we need to retrofit all houses, so not just the insulation and weatherization, it's installing solar, it's replacing, fossil gas appliances with electrical. It's a whole kind of like set of skills, and I'm wondering how this programming can plug into that kind of like scale up path when it comes from a workforce development perspective.
So we're really plugged in. So Justo mentioned our future endeavor to get folks more training in the industry, the green sector industry. We believe that those pathways, those early pathways for middle school are super important. Those young people will be done, in 5 years from now. We know that folks are not necessarily headed toward the 4-year route and are really interested in being employed. So we hope this exposure opportunity leads them toward the green sector. We have high schoolers that we work with that are telling us, what's next for us? And so in thinking about that continuity of opportunity for high schoolers who are finishing high school, who want to get straight into the industry. So we're hoping this training adds that exposure, that education, and a credential, and then making that connection to job placement. And all of this is really around the Climate Legacy Initiative. And I'll let you add more.
No, I think you hit it up. And one another thing that I want to add there is we continuously, we are reaching out to our industry partners, our community organizations, and again, it's just to see what are those gaps, and then what are those areas that actually, with some of, I would say, investment and intentional training, we can get our young adults into, this job. Like I said, it's important that we make them part of the solution, and they can be part of the solution, but also are earning, good wages.
Thank you.
Councilmember Ellison.
Thank you, Mr. Chair. Don't have too much of a question, just praise for the program. I think this has been, at least the ways in which you guys have interacted with North Minneapolis. You guys know that on the north side, when it comes to environmental issues, historically, I think people have seen environmentalism, environmental activism as something that's like, almost like tree hugger movement kind of stuff. But on the north side, we've seen, people are directly impacted and don't always realize the ways in which they're directly impacted. And people have other concerns like public safety, like education. job placement. And so for us to be able to have a program like this that can show folks how all these things are really married together, to have some of the partnerships, man, the Project Sweetie Pie logo is always so scary to me, but their work is incredible. I'm just deeply appreciative. And so I'm looking at these demographics of who's involved, and you can see folks want to install solar. Folks want to make sure that they have the skills and understanding of how to make sure that our workforce is growing in this direction, and they want to be a part of that. And representation and those kind of partnerships are a really big deal. You tell somebody that they got to care about the environment, and they're not sure where they're getting their next meal from. It's a harder conversation to have. You show somebody, hey, you can. You not only need to care about the environment, but you can be a part of the industries that are improving the planet. All of a sudden that buy-in just increases, multifold. So thank you guys for this program, and the partnerships that you have fostered here are really, they mean a lot to me, and I know they mean a lot to the community.
Thank you.
Thank you.
Thank you. Councilmember Rainville.
Thank you, Chair. And thank you for the presentation. Thank you for the smart work you're doing. There's nothing better for a society in general than individuals who have meaningful jobs and the meaningful compensation to make some money, to create wealth, but to also be contributing to a community at the same time. Thank you so much for what you're doing. I wish you the best of luck and ongoing success. Thank you.
Well said, Councilmember Rainville. I just want to say thank you for the work you and our staff are doing on these incredible programs. I think even when we look at the partnerships in general, I think you see folks like Little Earth, Avivo, Emerge, McGizzy, MPS, a variety of partners in the work that you all are doing to make sure that we're doing incredible work with a diverse group of folks. I think is important. And also even looking at the demographic component, I look at the age. I mean, you see the GCEP exposure programs. The majority of folks are 20 or under in there, and then you look at the GCEP credentialed programs and demographics. The majority of folks here are 30 or under. So I think that's really important. I think working with folks at a younger age is a really critical component and something that I'm very happy to see. So just really want to thank you all for your incredible work on this. And then I have two questions. They're pretty chill. The Melanin in Motion, I think that's the...
Yep.
Can you talk a little bit more about that?
Yeah, so this summer we work with, they are on the Wellness Center umbrella. And so this is a program actually who work with you. They teach them like bike skill, how to fix bike, but they also, part of that is they do a lot of field treat and they bring them and connect it with nature. Anthony have been amazing, also really kind of empowering our youth to become leaders. This is the way I see it is a leadership program in which youth are empowered to, number one, care for the environment, protect the environment, and understand that there is a benefit around that. And so we couldn't have asked for more from Anthony and his program this year. It was a great success with our kids. So and kids that goes through that, they also get paid for participating in that program, which actually is very helpful too.
Chair Chavez, I'll just add to that. It is the program is an apprenticeship program, so they're training young people to teach around biking and being in their community and cross-country skiing and downhill skiing. And we're with the health department, so we know the importance of the young people being outdoors and being in nature, and so that's really important for us to support outside of the job training.
And the exposure and resources for folks who sometimes may not have access to this, I think it's really important. So the point of me asking is making sure the public knows how this works. It's an incredible thing. It makes sure that people who may have not have access to these programs otherwise have actual, access to it. So just very appreciative of that. And then the last thing, really excited about page number 6. It's about the program timeline, seeing that in the future there's going to be trainings in Spanish and other languages. I think that is really important. And if you can just keep our offices, not necessarily engaged, but just posted on what that looks like. I think that's incredible. I think it's good to create access by providing this in different languages. So very happy to see that.
Just to elaborate a little bit, right now, like this is something, and some of our partners are here, and this is something that we know, okay, there is this particular program who provide these certifications, and then how we can, make this this program available to everybody, and so in their own languages, and so part of that is looking at train the trainer as a possibility, so we get members of that communities who have those language skills and train and support them through the training, so then they can be able to provide that training for the residents within their own languages.
Thank you. And thank you to any partner that is here today in the audience and listening at home too. So thank you both so much for the presentation. We really appreciate it.
Thank you.
Thank you.
And there is no one else on queue. So seeing no further questions, I will direct the clerk to receive and file that report. All right, everyone. Our next and final discussion item is receiving and filing a Health Department Health Disparities Report by Director Chaplin from the Health Department to introduce that item. Welcome, Commissioner.
Chair Chavez, council members, good afternoon. Just give me 1 second to set up here. Let's see what's doing here. Okay. So good afternoon, Chair Chavez, council members, Des Moines Chaplain, Health Commissioner, Minneapolis Health Department. Today I will be giving a brief presentation on the Health Department's efforts towards reducing health disparities in Minneapolis. Next slide. So as you already know, the Health Department is structured with 6 divisions, roughly about 14 plus programs, budget of about $40 million. 60% of that budget is generated through general fund. 40% for this particular year is being paid for through grants, and we have about 160 or so staff. Next slide. So in reducing disparities, what we are focused on is community engagement, proper data analysis, and then also developing those programs into policies going forward. Next slide. And so when we think about health disparities, we're thinking about root causes and causes of premature death. For us in Minneapolis, the top causes of premature death, those who are dying before the age of 65, is unintentional injuries, including drug overdoses, cancer, heart disease, liver cirrhosis, and then also homicide. These are consistent among our racial and ethnic groups, although the order may vary by group. Excluding other, unintentional injury was the top cause of death among all racial groups except for our Asian populations. The homicide was among the top 5 causes for our Black and Hispanic residents, and then diabetes and heart disease was among the top 5 causes of death for Black and our Native American residents. Next slide. And so we'll see here with the opioid-related deaths by race and ethnicity for 2018 to 2022, we see this significant increase in overdose deaths for our Native American, and then we also see an increase for our African American communities. Next slide. We also are seeing increases, significant increases in our infectious diseases areas for chlamydia and gonorrhea by race and ethnicity, and we're seeing both of those 2 groups, again, our African American and Native American groups, showing a significant increase in the rates of chlamydia and gonorrhea. Next slide. And so all of our programs focus on reducing health disparities. Some key issues include, some key initiatives include our Lead in Healthy Homes program, our racial and ethnic approaches to community health program, our REACH program, school-based clinics, our maternal and child health program, the opioid response, and then also what you just heard about, the public health pathways and green careers program. And so our Lead in Healthy Homes program promotes safe and healthy living conditions. We have a targeted audience, and it's funded through a combination of general fund general fund grants, our CDBG grants, our HUD grants, and our opera grants. Since 2023, the program has provided at-home assessments and contracted renovation services for lead, health, and asthma response for more than 600 households. And so when we look at our REACH program, the Racial and Ethnic Approaches to Community Health, it's a 5-year grant program to reduce chronic disease disparities in many of our at-risk communities, culturally tailored interventions to improve nutrition, increase physical activities, encourage breastfeeding, and promote adult COVID-19 vaccinations. This is our healthy eating and active living program. American Indian, particularly among American Indian and Black communities. And some of our strategies include nutrition, physical activity, breastfeeding, and vaccinations. And we launched our Produce RX program, which is pretty exciting. When we think about some of the programs that we have in Minneapolis, we really are tilting the scale on our prevention efforts, particularly if we think about our Lead and Healthy Homes and our Produce RX programs. These are pretty innovative programs that I'm actually pretty excited about. Next slide. And so our school-based clinics address health barriers and disparities by providing adolescent-friendly, accessible medical, mental, and health education services in 9 of our Minneapolis public schools, high schools. In our school year 23 and 24, we served just over 2,615 student clients, 13,000 individual visits, and a little over 3,700 mental health visits. The school-based budget is funded through insurance reimbursements, competitive federal, state, and local grants, and general fund. Next slide. Our maternal, child, and adolescent health program provides accessible, low-barrier health services tailored to our BIPOC families with culturally responsive and equitable health care through our family home visiting, our school readiness programs, children with special health care needs, our dental and vision programs, our immunization programs, and then our adolescents' sexual health programs, reproductive health access, and youth development programs. We hosted approximately 119 vaccination clinics since 2022. Over 60% of those vaccinated identified as BIPOC residents. Next slide. And so our opioid response program, you have heard this presentation before, but we have activities supported, implement a harm reduction framework to address prevention and access to low barrier treatment. We provide services and resources to individuals using opioids. We coordinate alignment with county, state, and opioid settlement funds investments across municipalities. And then our outreach partner, our Narcan training, we trained over 302. We had hosted over 302 trainings. Next slide. And so you recently heard about our Green Careers program and our Public Health Pathways program from Director Keys and Justo. Our Green Careers reduces racial disparities by increasing programming, access to training, credentials, and green career exposure for Black, Indigenous, and Latinx youth and young adults. The budget for the Green Careers includes climate legacy funding, opera funding, general fund, and then CDC funds for the Public Health Pathways program. Next slide. And so when we talk about the opportunities for addressing disparities within the health department, we're talking about continue building rapport with our community partners, which we have had here today, increasing and improving the way that we do our work, being innovative in our approach to prevention, and then also working really hard to be a part of the data modernization program and getting access to Minneapolis-specific data. Next slide. Some of the challenges that we have is that some of our programs are predominantly grant-funded, which means that it's cyclical and disease-specific and not always having the autonomy to do some of the things that we'd like to do. The data oftentimes is not timely or Minneapolis-specific. And then also really working on getting the root cause. If we want to flatten the disparities curve, we really need to focus on how do we do a better job of getting the root cause. And our Lead and Healthy Homes is a good example of that primary prevention programming really coming full circle. And then translating our pain into policy, that's part of our community engagement. How do we listen with an active ear, and then really be responsive through programming and policy to the things that we're hearing from the community. And then lastly, coordinating with collective impact. We have found, particularly through our opioid work and our opioid settlement dollars, that we may not have enough dollars ourselves as a city through that program, but when we work collectively with state and county, we really increase our opportunities for change. Next slide. And so what's on the horizon? We're in the process of completing our community health assessment and our community health improvement plan and our strategic plan for the health department. We have begun that just towards the middle of this year. We'll be finishing hopefully by next year. And that all leads into the application for reaccreditation. Again, we are one of the few accredited health departments in the country, and we're actually one of the fewer health departments that are going through reaccreditation. So, next slide. So that concludes the presentation, and I am open for questions.
Thank you, Commissioner Chaplin. Seeing if anybody is on queue. No one is, but I guess I'll ask questions. Thank you for being here. If you can go to the beginning of the pages, page number 5. It's obviously not a good graph to see.
No.
And I guess it highlights the severity of the situation of the situation here in Minneapolis. And I know that towards the end you talked about not concerns, but that it might be hard to get Minneapolis specific data. Do you know when we'll have access to 2023? I guess I would like to see if the issue is getting worse in Minneapolis as of last year. I'm not asking for 2024 because we're still in 2024. I feel like that's going to be hard to collect data, but I'm trying to see the picture of where we currently are, I guess.
It is a data lag, but we'll have Majeen respond to that.
Chairman Chavez, thank you very much. My name is Megan Keynes. I'm an epidemiologist with the Health Department. We do have 2023. Unfortunately, it just took a hiccup to get here. We also are working with electronic health records. Those are clinical records. Previously, we've only been able to see them at a very large geographic granularity that didn't lift up kind of what was happening in Minneapolis. We have access to that now at a tract level. We're working on obtaining that data. There's just a little bit of negotiating about making sure we're able to protect people's privacy. This is a rate per 100,000. The number's smaller, and we want to be real sure that we aren't identifying individuals. But we're well into that negotiation. We're just going back and forth on spreadsheets now, sir.
Thank you. But for sure, we have 2023. 2024 is basically getting figured out. I think what would be helpful here is when that data is available, or at least 2023, if we can follow up with council, we can just spread that information around. I think it's important for folks to just know what's happening and figure out how we can be supportive of addressing this issue. I know you all are working really hard to do so, but I think it's just helpful information for folks to have access to. So that's good. Mm-hmm. I don't think we need administrative follow-up because I feel like that might take some time, but if we can just talk offline and figure out how we can get that information out to council members, that'll be helpful. Mm-hmm. If we can go to page 8, the Lead and Healthy Homes. Commissioner Chaplin, maybe I want to give you an opportunity to talk about yesterday's press conference and some of the work from the federal partners as well.
Yeah, pretty exciting. This is one of those rare cases where we can talk about primary prevention at its core. When we talk about the work that we do from a disparities perspective and flattening that curve, we're really talking about getting the root cause. This program is getting to root cause. We know that the homes built before 1978 are homes that traditionally may have higher concentrations of lead. And before coming here, I hadn't heard about the tagline, but I think it's an important one. Not using our kids as lead detectors is important. Not only important, it's crucial because oftentimes when we do find out about lead cases, it's after a child has been poisoned. So this is being proactive and really getting into homes before a child is poisoned and being really active as a partner, community partner, and helping to get those homes deleaded. And so I'm actually super excited about this particular program. We're looking forward to helping expand this program to get to homes sooner, and the sooner we can get to those homes and provide services and support, the greater opportunity we have to reduce a child from being left poisoned.
Yep, and on top of that, the federal government delivered a $6.7 million grant to the city, and I think that just shows the work that staff has been doing, and is showing the nation of what Minneapolis is doing and will continue to do. So just wanted the public to know that that work is happening, and that's really good news. So thank you, Commissioner. I have two last things. The Narcan training component towards the end. It isn't really a question that I have, but those are really important. And I'm just putting it out in the ether, at least for you, Commissioner, to know. We're going to be reaching out for Narcan training with some of our residents that want to have opportunities. We've done this in the past with your department, but folks in Longfellow area are hoping to do a Narcan training in the community, along with how to safely pick up needles off the ground. So we'll be reaching out separately outside of here to schedule that event before the end of the year. And then the last thing I have in regards to the opioid response, do you know when we're going to get an update on the safe recovery study that we're doing with St. Paul, or when we would hear back from that?
Let me ask Deputy Commissioner.
Perfect. And that's my last question.
Good afternoon, council members, Chair Chavez. We are finalizing a draft of the RFP that will be released to bring in a researcher for that part of it. So we're just working through logistics, excuse me, with working with another county. We're the fiscal agent, but we have to get our MOUs and things together with their attorneys and our attorneys. So that's the update on that.
Perfect, thank you. And that's St. Paul and Ramsey County then, right? I think it's both, or?
Chair Chavez, committee members, yes, they are an integrated public health department.
Good to know. Thank you.
You're welcome.
Perfect. Okay, let me see if anybody else is on queue. No one else? Okay, well, Commissioner and our staff, thank you all for this comprehensive report. We really appreciate it. There's a lot of things to take into consideration. So thank you for being here.
Thank you, Chair Chavez.
Yep. So seeing no further questions, members, I will direct the clerk to receive and file that report. And seeing no further business before us, all right, we'll declare this meeting adjourned.